Did you know that in labor, if you're considered to be low risk, you have another option besides continuous fetal monitoring? There is an option called intermittent auscultation, and that's where they use a Doppler, like when you go to your provider's prenatal appointment and they listen to the fetal heart rate with a Doppler. It works the same way. And this can be used intermittently throughout labor if the mother is low risk. What's interesting, this is approved by American College of OBGYNs. That's your physician organization for OBs. And what we have found is that in the research, intermittent auscultation is just as safe as continuous fetal monitoring for women that are considered low risk. That means you're having a healthy pregnancy without complications. So that's a great option to discuss with your provider if that fits your situation.